Welcome back. Colorado is following a heartbreaking trend. The state health department says maternal mortality rates are going up, mirroring what we're seeing across the country.
A new CU Boulder study is adding a layer of understanding to the kinds of racisms moms face in the delivery room. Our Anusha Roy joins us live in studio to explain. Good morning, Anusha.
Good morning, Jordan. You know, the state said every year they are tracking and studying why between 35 to 45 moms are dying within the year of giving birth. Now there's a CU Boulder study that is highlighting what some of these moms are up against. The researchers were analyzing tens of millions of births, both nationally here in Colorado as well, looking specifically at when moms are induced. The study's authors found that often care is based on trends in the white population when it may not be the best medical decision for Black and Latina moms as well as their children. And it speaks to this very scary reality. When you look at CDC numbers, it shows that Black moms are nearly 3 times more likely to die of pregnancy-related causes than white moms. 9 News racial equity expert Dr. Rosemary Allen said that this is coming down to bias and racism.
The most visible example is what happened to Serena Williams and how she almost died in childbirth because she knew that she had a blood clot and no one would listen to her. Another local example where a mother was experiencing edema. She had fluid on her lungs because she was overhydrated. And while she's waiting to go into ICU, a nurse walks in with a bag of fluids. And had she not been asked, well, what are you going to do with that? She would have given the fluids to this mom, this new mom, which probably could have been fatal.
So Dr. Allen said that a lot of moms' concerns are being ignored or they're dismissed. In many cases, their level of pain is underestimated and emergency C-sections are delayed. All things that can be prevented and in turn could save a mom's life. That's why Dr. Allen said anti-bias and anti-racism training is so critical, and it's happening here in Colorado. The state has paired up with organizations to do that exact kind of work. There are hospital incentive programs to make improvements, as well as the state getting $5 million to boost programs to address this problem. The issue is unfortunately, we're just not seeing these numbers go back down.
Right. I truly believe that you have to be your own advocate when you're walking in there, right? You have to be so knowledgeable. What options do moms have?
Yes, Dr. Allen said that a lot of times what she's seeing is moms are hiring doulas and midwives if they can afford it, right? Because then you have a medical representative in there who can advocate for you. For those who don't have that kind of money or it's not a financial option for them, unfortunately, it is falling on the mom to advocate for themselves in such a difficult time. You think about you're having a baby, it's emotional, you're tired, you're exhausted, and in the middle of all of that, you're having to say something's wrong, and if you're not listening to me, pushing and pushing and pushing to say, pay attention to what's happening.
Be able to have somebody, you know, with sound mind that's able to do that whenever everything's chaotic for you.
Exactly. It's a lot to put on a mom.
Well, this is certainly eye-opening. Thank you.